Hello guys, Dr. Nikhil here, MD of Sangyani. Welcome to my YouTube channel. Today I will teach you how to prevent any pregnancy just by using the calendar and nothing else. This method is called calendar method. But I warn you, this method is very primitive, theoretical, it has least efficacy, it has highest failure rate. And again, I warn you, if you truly want to prevent any pregnancy, I advise to use other methods like OC pills, injectables, implants, copper teas, etc. It is for those people who want to have an idea what is a fertile period and what is an infertile period, and for the students who are appearing for the exam for the theory. Come, let's learn what is calendar method. So imagine you are a woman who are having cycles of 28 days, which means you are getting period once in 28 days exactly. This is scenario, this is ideal scenario. Okay. Now, this is day 1 of your menstruation, which means the cycles has started on this day. Day 28 is last day of this cycle, which means on the next day, the next cycle starts. On the next day, on 29th, the next menstruation begins. Understood? Now, if the cycle is of 28 days, you remember a number that is 14. 28 minus 14 is 14. It is not a number, it is a day. Subtract 14 from the last day of this cycle. Okay. This day coincides with a process called ovulation, which means the ovum or the egg will release from the ovary and is ready to meet the sperm and fertilization. Understood? Okay. So this period is a danger period. This period is a fertile period. When you have sexual intercourse in this period, of course, there will be pregnancy. Okay. Not only this day, 5 days prior and 5 days after. डे 14 से 5 दिन पहले, डे 14 से 5 दिन बाद. 5 days prior to this day and 5 days after this day are considered as fertile period, which means if you mate, if you have sexual relationship with your husband in this period of time, there is high chance that you are going to conceive. A pregnancy is going to result. This is called fertile period. If you want to avoid this pregnancy, you have intercourse outside this period. Outside this period. Understood? Okay. This 14th day does not mean that 14 is between 28. No. Just subtract 14 from the last day of this cycle. That's it. Now imagine. Second scenario. You are a person who are having cycles not once in 28 days, but once in 35 days. What we are going to do? Subtract 14 from 35, which will lead to 21st day. 1 to 35 is your cycle, minus 14, 21. This day is a day of ovulation. Now, consider 5 days prior and 5 days after this day as your fertile period. So in this case, if you want to avoid pregnancy, have sexual intercourse or you can mate outside this area. This is a danger period, fertile period. If you have intercourse outside this period, you will avoid any unwanted pregnancy. Understood? If you are a woman who are having cycles once in 21 days, same again, 21 minus 14 is 7. 7th day is the day of your ovulation, 5 days prior to it, and 5 days after is a danger period. In this case, 5 days prior to it, from 2nd day of cycle to 12th day of cycle is a danger period or fertile period. If you conceive, if you mate in this period, obviously there is high chance that you will conceive. 5 days prior मतलब कितना हुआ 21 minus 5 from 16th day to 27th day is danger period or fertile period. Here day 14 minus 5 is 9th day to 18th day is fertile period or danger period. Okay, you can see here as the cycle lengthens in 35 day cycle. Okay, the non-fertile period, the safe period, is comparatively longer. Is longer here as the cycle length reduces in 21 day cycle length is very less. The fertile period is more and the non-fertile period or the safe period is comparatively less. So have an idea, if your cycles are short than usual, 21 days, 22 days, 20 days, sometimes even 19 days, the safe period, the window of safe period will also narrow. Right. Now imagine in January, forget the year. In January, if you are having 28 days cycle, day 1, a cycle starts, first day of your periods, and day 28, the cycle ends, which means from day 29, next cycle starts, next period will start. Okay, now 28 minus 14 is 14, minus 5 and plus 5. So this 1, 2, 3, 4, 5. Now plus 5. 1, 2, 3, 4, 5. Whatever the color, whatever the shading you can see here, this is danger period. The remaining is fertile period. Got it? If you are having 21 day cycle, day 1 and day 21. 21 minus 14 is day 7 minus 5 and plus 5. this area is unsafe. Yes, this area is unsafe for sexual intercourse to prevent any pregnancy. The remaining area, of course, it is considerably safer. Next, if you are having cycles of 35 days, 1, 2, 3, 4, 5, 6, 7, 30 here, then 31, 32, 33, 34, and 35 is here. 35 minus 14 is 21. This is the day of ovulation. This is the day of ovulation. Minus 5, 1, 2, 3, 4, and 5. Now plus 5, 1, 2, 3, 4, 5. This shaded area is unsafe period or fertile period. The remaining area is safe period. So this is basically how you calculate the fertile period and non-fertile period in a regular cycle. See, this technique holds good in a regular cycle. If you are having 28 days cycle every month, or if you are having 35 days cycle every month, or if you are having 21 days cycle every month, it means your frequency of menstruation is constant, either 21 days or 35 days or 28 days. Imagine if you are a woman who is having erratic cycles, irregular cycles. In January, your cycle's frequency was 21 days, February 28 days, March 29 days, in April 30 days, May 32, June 36, July 31, August 30, September 31, 29, November 28, December 26. You know that in a regular cycle, you should subtract this number with 14. In this condition, what will you do? You will tell, sir, I don't know when will I have next menses. I don't know the date of my next menses because it will be very, very irregular. You don't worry about that. There is technique for this problem also. For that, you have to have a prior sample size of at least 6 months. I mean, January to June. Okay, you have to have sample size of at least 6 months. January, February, March, April, May, June of previous year. Or even you can take this sample also in July to December, doesn't matter. Okay, now there is a formula which is very, very simple. Okay, shortest cycle among this sample size is 21. Longest cycle of this sample size is 36. You subtract shortest cycle with 18 and longest cycle with 11. 21 minus 18 is 3. 36 minus 11 is 25, which means from day 3 to day 25 of your cycle is a fertile period, which is an unsafe period. Okay, once you are having samples of 6 months from next cycle, by this formula, you should plan accordingly, which means that from day 3 to day 25 of the coming cycle, consider it as fertile period or unsafe period. Outside this period, outside this cycle, from day 1 to 2 and from day 25 onwards is a safe period in which you can mate with your partner and still avoid pregnancy. Got it? This formula is simple. So this is the month of July. We took a sample size from month January to month June, which is of 6 months. Okay. So shorted cycle was 3. Okay. Now from January to June, we took sample size, and from July we are plotting on the calendar. Imagine this period, day 3 to 25 is fertile period. Got it? So this is a calendar of July month. July month. Imagine the first day is day 5. Imagine day 5 is the first day of period in the month of July, and your previous cycles were erratic and irregular. So from day 3, this is day 1, this is day 2, this is day 3. From this day to 25th day 3 to day 25 is unsafe period or fertile period. Day 1, 2, 3, 4, day 3, day 4, day 5, day 6, day 7, day 8, day 9, day 10, day 11, day 12, day 13, day 14, day 15, day 16, day 17, day 18, day 19, day 20, day 21, day 22, day 23, day 24, and day 25. Whichever dates I have shaded is unsafe period, not only for this month but also for coming months. Day 3 to day 25 of your cycles of coming months, subsequent months, should be considered as unsafe period or fertile period. So if you have intercourse, if you perform coitus or mating outside this period is considered as safe period. So, but it is very lengthy. Yes, our cycles are also very erratic. My job is to teach you the safest period, no matter how narrow the margin is. Right. So I hope you got a basic idea how to calculate your fertile period and safe period. And beware, I'm warning you again, this method has very least efficacy and high failure rate. So I advise that you don't use this technique to avoid pregnancy. There are other efficacious methods like condoms, ossipills, implants, copper teeth, etc. I taught you this technique to be aware of your own body's biology, when is the fertile period or when is the unfertile or safe period. And this video is also for the doctors or the medical students, nurses who are preparing for their exams or entrances, etc. So if you like the video, if you like the concept and my teaching, kindly like, comment and share. And please subscribe for more teaching videos, educational videos like these. Thank you.